Hello fellow PEMA students, my name is Lymphedema. This presentation is brought to you by Adria, Rebecca, Roy, and that awesome dude Thad. I am here to explain secondary lymphedema, but first I must briefly describe a lymphatic system. Most of us know about the circulation system that pumps blood from the heart to the rest of the body. The significant number of individuals, however, are not aware that the body also has a second circulation system, the lymphatic system. There is a series of vessels, glands, and lymph nodes that comprise a lymphatic system. They are spread throughout the body, in a similar way to blood vessels. The lymphatic system consists of the tissues and organs that produce and store cells that fight disease and infection. They include the bone marrow, thymus, lymph nodes and spleen, as well as the channels that carry lymph. The lymphatic system has three main functions. The first function is fighting infection. The lymphatic system transports a watery, clear fluid full of lymphocytes. Lymphocytes are infection-fighting cells. The white fluid is known as lymph. The second function is draining excess fluid. After blood has circulated through tissues, it leaves fluids and proteins behind. These are waste products. The excess fluid is drained through tiny capillaries and into a lymphatic system. After filtering out bacteria, viruses and other undesirable substances or organisms, the clean fluid is then returned to the blood. This filtering is done by the lymphatic system. The third function of the lymphatic system is lipid fat absorption. The lymphatic system also absorbs lipids from the intestine and transports them to the blood. Now for the part we have all been waiting for. What is secondary lymphedema? A disruption to the lymphatic system can eventually undermine its ability to drain fluid properly, resulting in excess fluid swelling in parts of the body called edema. There are two main forms of lymphedema. The first is primary lymphedema, often called congenital lymphedema. The lymphedema is evident at birth or shortly after puberty. The second form is secondary lymphedema, which results from the disruption or obstruction of the normal lymphatic system. Secondary lymphedema is an acquired condition. Acquired means that you get it somehow and are not born with it. The lymphedema occurs as a result of something else, such as an infection, injury, trauma or cancer which affects a lymphatic system. Lymphedema may be a side effect of cancer treatment, such as radiotherapy or the removal of some lymph nodes, which may damage the lymphatic system. In the United States, the most common cause of secondary lymphedema is malignancies and their related treatment. In other words, cancerous tumors and their removal. More women are affected than men, and breast cancer is the #1 culprit. Secondary lymphedema can be caused by orthopedic injuries and surgeries resulting from injuries to the bones, muscles and joints. Neurological conditions such as muscle paresis, CV8, post-polio, spastic paralysis. Vascular injuries/surgeries caused by vessel injury from trauma or unintended trauma from catheterization, removal of a vein/veins for CABG or leg bypass. Integumentary injuries such as trauma to skin, degloving injuries, burns, damage to skin from long-term steroid use, i.e. for COPD or RA. Secondary lymphedema can also be caused by infection. Scar tissue formation caused by multiple abdominal surgeries, i.e. gallbladder, TAH, umbilical/abdominal hernias. Secondary lymphedema can also cause lipedema. The term lipedema was first used by Allen and Hines 1940 to describe the symmetrical swelling of both legs, extending from the hips to the ankles, caused by deposits of subcutaneous adipose fatty tissue. I hope you enjoyed the presentation. My friends here will fill you in on the rest of the information about lymphedema.